We're going to go into some other details surrounding thread lifting techniques and why they are very rarely the solution of choice for most of the facial aging issues that people tend to employ them for. If you're new to the channel, then welcome. If you've been to the channel before, then welcome back. Great to see you. Today we're going to talk about the problems associated with thread lifting. Thread lifting has become a very, very popular technique for people to use to elevate their face, cheeks, temples, brows, even their sagging neck. They were essentially invented and developed in the late 90s, and the goal when they were first introduced is to give a subtle natural lift by means of barbed threaded suture material, which are put in under local anesthetic in a simple outpatient procedure. They are sold as a 20-minute local anesthetic facelift type technique. Threads were always promoted as being a safe, reliable, simple technique. And one of the key advantages was always suggested to be that they were dissolving, and so the effect would admittedly be temporary, but if there were any problems or concerns, then again these problems would be temporary. Now in this video I very much want to talk about how this, far from being a upside or positive selling point, is a very significant negative, and we're going to go into some other details surrounding thread lifting techniques and why they are very rarely the solution of choice for most of the facial aging issues that people tend to employ them for. So if you watch to the end, I will share with you what I think are better alternatives to thread lifting, but for now let's get into it. As you will know if you've seen any of my other videos, the nature of facial aging is multifactorial, so it's not simply a matter of some of the tissues sagging. As you will probably know, then multiple areas of the face tend to age in slightly different ways. Some tend to gain volume or lose volume, like the cheeks, for example. Some areas tend to fall, like the brow or the jowl or the neck. And in many areas, the skin quality changes irrecoverably to the point where it becomes too fine, and the inelasticity of the skin means that the soft tissues deeper are no longer supported, and this contributes to the sagging. For most patients, these facial aging changes happen in their 30s and certainly gather pace in their 40s, and by the time we get into our fifth decade, then these changes are often quite profound, and it is around the 40s or 50s where patients come to see me to discuss some of the surgical techniques that are available. Thread lifting was invented to try and address some of the early changes to facial morphology, addressing facial aging in a patient population in their 30s, and for this specific indication then they have some merit, but unfortunately, as is the way with many of these techniques, we have a phrase in plastic surgery: if all you have is a hammer, then everything looks like a nail. And if you are a thread lifting specialist, then you will find multiple different reasons to use them, even way beyond their scope of initial intention. One example where thread lifts do not offer a reasonable solution, in my opinion, is the brow. Now, as we age, the bony orbit gets a little bit larger, and what we find, especially in men, but certainly in ladies as they get a little bit older, is the brow starts to descend. What we notice more often is that the tissue between the brow and the eyelid starts to roll into the orbital hole. Now, this makes us look tired or grumpy or surly, and people have tried to use thread lifts to lift the soft tissues back out of this hole. The difficulty is that in plastic surgery we have a great number of surgical techniques designed to do this, and all of them are very surgical, very interventional. There is a lot of drilling and screwing and incisions and heavy duty stitch material, and even with all of that, the results are usually modest at best. In my experience, thread lifting is nowhere near powerful enough to exact a change of the brow position, and it's not really indicated to deal with heavy upper eyelids as the tissues are too thin. So we often see patients who have had 2 or even 3 threads put into each brow in an attempt to lift a brow. and all that they have is either a lumpy forehead where the threads can be seen through the relatively thin tissue, or a suboptimal result. So I don't think I've ever seen a positive result with thread lifting for brow lifts, and so in my experience and opinion, I don't think this is a great technique. Furthermore, brow aging is a long-term problem. Once the brow starts to fall, it's never going to rise up again, and as we mentioned earlier, thread lifts only last for 6 months at most, and then the stitch material dissolves. This is how they're designed, and so a 6-month solution is unlikely to be the answer to most of these patients' problems. One of the main problems with facial aging is a change in size and shape of certain elements of the bony skeleton. Now, as we mentioned just previously, the orbits change size and shape, but a number of other anatomical elements also change. The piriform fossa, which is the hole over which your nose sits, gets a little larger. The maxilla and mandible, the upper and lower jaw, get narrower and get shorter, and the teeth become more exposed. We see the whole bony skeleton of the skull shrink a little, and this manifests itself in terms of facial aging as sagging skin. Now, you can imagine how, from a facelift point of view, this can easily be addressed. We can tighten the skin, but when it comes to thread lifting, then the thread can only gather up the tissue that you have. It can't remove anything that is in excess. And so this is a real problem for anybody who has a significant amount of sagging skin, because the threads will not remove any of that. There are no incisions, so no skin can be removed. And so this leaves us with a suboptimal result in anyone who has significant bony changes. And in my experience as a plastic surgeon, that's the vast majority of patients who are over 50, and in many cases quite a significant number of patients who are over 40. Furthermore, the one fundamental compromise with thread lifting is that it is by definition temporary. The threads are designed to be dissolving, and in many cases they are designed to dissolve and fail within 3 to 6 months after application. And so you have to accept that the likelihood of a thread lift result lasting any longer than this is extremely slim. And so you are accepting all the complications of a given technique, but for a relatively limited advantage. So what else is suboptimal about thread lifting as a technique for all facial aging? Well, the other thing that we see relatively commonly is in ladies with thin tissues. Again, this is something we see very often in 50s and 60s, especially when those patients are of a generation where sun damage was commonplace. Sunbeds were used a lot for patients of my age and a little bit older. Then what we find is that the material of the thread can often be seen through the skin. If not the material, then certainly the effect of the material, the crimping, the gathering, can be seen through the skin, and the thinner the skin is, the more visible the material can be. Now, this is a real problem because threads are typically put in very obvious flat surfaces of the face, like the forehead, like the cheeks, and certainly in the neck they're quite commonly used. And if you see wrinkling and crimping of the tissues, then it's an absolute giveaway that thread lifts have been used. In these cases, we often find we're just waiting for the material to dissolve, and so we tend to wish for the material to fail, which is far from ideal in a product and a technique which can cost, as I say, many thousands of pounds. Two more significant complications that we see are nerves being pinched by the threads. Now, the advantage of the threads being dissolving is that if the nerves are pinched, then as the threads dissolve, the nerve tends to become unpinched, and so long-term nerve problems are rare, but patients who have threads often have them put in by not plastic surgeons, people who aren't as familiar with the surgical anatomy as we plastic surgeons are, and the way they're put in is by definition blind. We cannot see the anatomy through which the threads are placed, so it's not impossible to grab a nerve and pull it in a way that makes it paralyzed for a period of time. The branches of the facial nerve are very fickle, and they often get paralyzed at very little stimulus and can take weeks or even months to come back. We see this in surgery, but of course when we do surgery we know where they are and we know what we're looking for, whereas thread lift practitioners tend not to do so. And this fundamentally is one of the basic problems. Threads are placed by aesthetic practitioners, usually trained doctors occasionally, but very, very rarely plastic surgeons. I don't know very many plastic surgeons who use them at all. I say to my patients that if you're prepared to put yourself through a technique which is half as expensive and 1/10 as effective, then you should probably consider a more definitive technique like a surgical correction of whatever problem it might be. And most if not all plastic surgeons think the same way. So be aware when somebody offers you a solution which is simple, cheap, easy, and can be done as an outpatient, because as always, there's a catch. If threads become infected, then this can be a serious problem. They are designed not to be removed, and when they're brand new, the barbs on the suture material is very difficult to take out. I've even had to remove threads that are 6 months, a year old, and what you find is pieces of thread material that are completely broken, but are still effective at grabbing the tissues and are very, very difficult to take out. If you had a brand new thread that became infected and it had to be surgically removed, which is almost certainly the outcome that you would see, then it would be extremely challenging and very surgical to have that thread removed. I've never had to do this, but I think you are likely to cause significant problems. And I think if any of the thread practitioners attempted to do this themselves, then there would be some significant concern if I were the patient. I don't even think as a plastic surgeon with many years facelift experience, I would want to remove a brand new thread that had become infected. So this is definitely something that you should consider. So in summary, in my opinion, threads can be a useful technique, but in a very limited population group. For patients who have a little bit of sagging of soft tissue areas like the cheek, for example, but have no skin excess, then typically the patient who's 30 or 35 who wants to make some subtle changes to their nasolabial folds, for example, then threads can be an option for these patients. Admittedly, there is a limited downtime, although bruising is not completely unheard of, but the application of threads is not without its complications, and most importantly, the effect is likely to be 6 months at best. And so please be aware that if a 6-month solution is all you're looking for, then this is the only good reason to be putting threads, in my opinion. For most patients in their 40s and 50s, then I advise to save up your money and commit to a definitive surgical procedure, which is not without its own set of complications, but the benefits are clearly outlined and will be discussed with you in detail, and there is much less likely to be obvious disappointment with the overall outcome or the length of effectiveness of the outcome. Overall, thread lifting is nowhere near as good a technique as it is suggested. It has limited applications, but it is not inexpensive, and its effect is very short lasting in the vast majority of cases. So as a facelift surgeon, I would suggest that you at least have a consultation with a plastic surgeon to share with them what other options there might be. It's always good to speak to someone who knows all of the techniques and can evaluate them based on their individual merits, rather than someone who only knows one technique and is trying to sell it to you as many times as possible. Thanks for watching. If you enjoyed this video, then please like and subscribe, and by all means go to our channel where there's a number of other videos on plastic surgery topics that hopefully you'll find interesting.